Okay, moving on to chapter 3. We're going to skip 2 for now, human reproductive anatomy and physiology. I didn't really cover this well. So puberty, we kind of talked about a little bit, the change in physical appearance, the beginning of the secondary sex characteristics. For men, puberty starts between ages 10 and 16. And then, of course, all the changes to the male body, growing taller, more muscle, secondary sex characteristics. The testosterone levels are constant, they're not cyclical like with the female's menstrual cycle. For females, obviously, there's the breasts grow first, and then 2.5 years later, the first period starts. Um, okay, so the penis, obviously, you have the urethra, and then the sperm are created in the testes, which is housed in the scrotum sac, and that's called spermatogenesis. The the sperm is stimulated to form with the androgens, which are just the male sex hormones. Testosterone, we talked about, increased muscle mass and strength, bone growth, red blood cell production, all that kind of stuff. Um, Okay, so the epididymis. So you have the testy, which is in the sac, and then around the testy, kind of on top, is a little gland, or not a gland. It's more like a little teeny tiny sac. It's called the epididymis, and that's where the sperm is stored for 2 to 10 days before it then travels along a tube that's connected to that, called the vas deferens, which then um, transports the sperm into the urethra. And that's when you have the prostate and other glands. Okay, sorry. So the prostate and the other glands that are there, and the seminal vesicles. There's a bunch of other fluid that goes with the semen, with the sperm to create semen, and all that fluid helps transport the sperm, but also nourish it. Um, Nourish them. So you've got the seminal vesicles, the prostate gland, the Cowper gland. Okay, so all these glands secrete fluid that nourish the sperm. Okay, so the female genitalia. So, like we talked about before, the mons pubis, which is housed above the vagina. Then you've got the labia majora and minora, and those secrete fluid which help lubricate the vaginal canal. The labia minora also secretes a bactericidal fluid which helps prevent infection. So you have to remember that the vagina regulates itself. It regulates its pH, and the bactericidal helps prevent infection. So there is a balance there. So keeping that in mind, so if women are on antibiotics, that can mess with that balance, or if they douche or clean, there's all kinds of things that mess with that balance. And then of course the cycle also, because of the hormone changes and everything kind of changes. But it is to a large extent self-regulating. And then the fourchette, which is another word for the perineum, which is between the anus and the vagina, and that space can sometimes rip during birth. And then, of course, you have the vaginal vestibule. Um, so, about that, fourchette. Um, so, inside the vaginal vestibule, so you've got so that's where the just above that, though, that's the urethral meatus. So that's where the urine comes out, above the opening of the vagina. So then you've got these right here. Well, then of course the hymen, and which, by the way, can break for various reasons, not just sex. If girls fall or whatever. These ducts right here, the Bartholin glands, they're the ones that usually lubricate the lining of the vaginal vestibule during sex arousal. We talked about the perineum. Oh, that's not, oh, here we go. This is what I'm looking for. So the actual structure is a muscle. The actual vagina is a muscle. The rugae, those are like, in a lot of those muscles, so they're just like ridges along the vaginal wall, and they stretch and they contract, and they stretch obviously to accommodate a baby's head coming out. Um, and this is in your book, this picture here. Let's see. So we talked about the self-cleaning. The vagina, yes, it's a passageway between the uterus and the outside. And then the uterus. So obviously it's a muscle. The whole thing is a muscle, and that's where the fertilized ova implants and turns into a fetus and so on. It is shaped like an upside down pear, and it's between the bladder and the rectum. And it is supported by these ligaments, which can become problematic during pregnancy. They stretch. Sometimes they cause kind of uncomfortableness and pain. And then, of course, they can get really loose after birth. And so sometimes in older age, and if a woman has had a lot of children or does not exercise regularly, the uterus can start to fall, and the bladder as well. So Kegels are good. So let's see. The autonomic nervous supply, if you remember, back to your neurology system. So it's not conscious. It's not voluntary like motor. So the cervix is at the lower part of the uterus, and it's sort of long and thin. And then, so there's an outer opening and an inner opening. And so this is sort of the entrance, and it will plug during pregnancy to prevent anything from leaking out. Fallopian tubes are on the other side. Obviously, that's where the egg travels to the uterus from the ovaries. So there you go. So ovaries. So we're talking about that long vagina part before the uterus. The uterus is on top, and the long portion is the vaginal canal. So these are all, so the fallopian tubes, so obviously that's where the ovum travels. That is where the egg is fertilized. And sometimes it can be a nourishing environment. So when we talk about ectopic pregnancies, most of the time they happen in the fallopian tube. The egg becomes fertilized, and then it doesn't travel to the uterus. Ovaries, they're almond shaped. You have two, and they alternate in terms of producing eggs, usually. So, and then the bony pelvis, again, you don't really have to know these except that the gynoid is most favorable for deliveries. There is a true pelvis and a false pelvis. I don't know if you really need to know this either. Pelvic outlet. So the breasts, we talked about those. So the reproductive cycle. So obviously it starts with the anterior pituitary gland, which then secretes hormones, the follicle stimulating hormone and the luteinizing hormone, to release the egg from its shell, the corpus luteum. The cycle usually start to end is 28 days. So ovulation usually happens in 14 days. And so at that 14-day is when the egg is released, and the woman is fertile for up to 5 days, for up to 24 hours. Sperm usually can live for up to 5 days. So it's 24 and 5, 3 to 5. So pregnancy can occur. So if you ovulate at day 14, and you had intercourse day 9, you can still get pregnant. So 5 days before, 5 days, right, 5 days before. So just keep that in mind for phases. I don't really need to know any of this. So just keep that in mind. The ovary, the ovum, the egg can survive for 24 hours, give or take, and the male sperm can survive for up to 5 days. So that's your period of pregnancy. Okay, so just keep that in mind. And I'll see you at the next chapter.